So, how does early childhood poverty affect later development? Poor children show chronically elevated stress levels of cortisol, which may wear down their bodies and prevent premature illnesses and death.
Good afternoon. How are you and the baby been?
We've been alright, but can we kind of hurry this up because it's gonna make me late for my plans that I have later. Because I'm going out with my friends because I just need a couple drinks because the baby's gonna drive me insane if I don't. She hasn't been eating right with me. She's not sleeping through the night at all. All she does is cry, and the only person she responds to, is the babysitter, and I have no clue what to do.
So. Oh, I'm sorry you're having these difficulties, but I recommend staying home from work a few days to spend time with her so she can become close to you, or she will continue to act in an abnormal way when it comes to performing her daily activities with her because she's not used to having you around. Your personal health affects her more than you would imagine. When you are stressed out, it will only make her feel unwanted and upset.
Okay, yeah, I'll try to work on it.
Sounds good. I'll see you next week and hope to see positive results.
Alright, thanks.
Hello, how are you and the baby?
Hi, we're actually doing really good. We just came from our weekly mother-daughter class, and she's been sleeping very well, mostly through the night, and she's been eating on schedule, and she's just been a very happy baby overall.
I'm glad everything's going well. Let us know if you have any questions.
Thanks. I'll see you next week.
One factor affecting how infants are raised includes their ethnicity. Parents want infants to be healthy and to maintain their cultural values. The parent's goal of maintaining cultural values often affects how the child will be raised. Infants in the United States are raised to be independent and individual, whereas infants in Japan are raised codependently with their mothers from infancy. Health-wise, many Black infants are born prematurely, and many Black infants born to mothers living in low-income neighborhoods are more likely to have low birth weights. Black infants also who sleep in the prone position have higher risks of SIDS, or sudden infant death syndrome, and Black infants born small or prematurely have higher rates of cerebral palsy as opposed to their white counterparts.
Breathe easily. SIDS affects a baby between the day that they are born to 12 months old, but is highly effective between the ages of 2 to 4 months old. This baby is at risk to SIDS while asleep, whether that be for nap, bedtime, whatever it may be. You never know when this might occur to your baby. Some issues though that occur to this is how you put the baby to sleep. Some parents put their baby to sleep on their stomach or on their side, which is not okay. Putting their baby to bed on their stomach will cause the airways to shut, and with that, the baby will stop breathing and will die of SIDS. We don't really know what is mainly causes SIDS, but there are ways to get these issues to be slim to none. Also, some issues that occur to SIDS is how the mother takes care of the baby while in the stomach as well. So if you smoke or drink alcohol during the pregnancy, that can affect your baby to have SIDS. The way that you care for the baby, all these certain things that you get ready to do before the baby is here can affect SIDS. Also, things that cause you to take the baby to a certain level of knowing when and what is appropriate for your baby come time for them to go to sleep. SIDS is the #1 death for an infant, and the way you take care of it is very crucial to your baby's life. SIDS is not something you need to take slightly. It has decreased from before, and nowadays it is very low, but the way your child is put to bed is very crucial for their life. So always make sure you put the baby to sleep on their back. Make sure there are no blankets and stuffed animals. Make sure you have a fitted sheet around the mattress, and make sure your mattress is firm. All these things can make these issues go away and help your baby live a wonderful and beautiful life.
Hi, my name is Alexis, and I'm here to talk to you about improper nutrition in infancy. It is very important for infants to have the proper nutrition so they can grow up being healthy and strong and not have any illnesses. It is known that improper nutrition has been linked to illnesses and childhood obesity, which is a growing problem in the United States today. In order for infants to grow and stay healthy, they need calcium, zinc, proteins, carbohydrates, which is all found in breast milk. It is crazy because a lot of women in today's age choose not to breastfeed, but breast milk is the most nutritious that an infant can get in this early age. The breast milk can help a child if it is sick. It can remain and stay healthy. It's also free. Formula is very expensive and is not as healthy as a breast milk can be. Improper nutrition increases the risk of illness and is known to be responsible for 1/3 of the 9.5 million deaths in children under 5. It is recommended that women breastfeed up until at least the age of 6 months so that the infant can get that source of nutrients that it needs. It is also very important because it also builds a bond with the mother, which is also a way of having a very healthy diet included, because then the baby can grow up knowing that it is loved and then also be getting that very important nutrition that it needs in today's age. It is very easy for babies to get sick because they are so small and any virus can attack their system and be very harmful for them. So it's very, very important that an infant gets the proper nutrition. So in order to do that, I encourage all women who have kids to breastfeed as long as they're able to. If you're able to, then I do not believe there is a reason why you shouldn't breastfeed. It is the best. It gives the baby nutrients, and then it doesn't leave way for improper nutrition to take effect in infancy.
In the effects of overly disciplining, it is very important not to hit, spank, slap a child of any age, especially infants. Infants are unlikely to be able to make any connections between their behavior and their physical punishment. They will only feel the pain and the hit that has been targeted at them. Infants become traumatized and stunt their development because of what they had to go through as being an infant. They don't understand what you are saying, and they don't understand the word no, but they do respond to your tone and the parent's voice, and it can also be redirected. So warnings, spankings, and threatening infants are not only ineffective, but it's ways of disciplining them that they become counterproductive. Some developments can come slower than others, or some can come slower as usual, but because of the screaming and the yelling while they're infants, it won't come as normal as a normal infant because it also traumatizes them.
Whether you're a first-time parent or more experienced, it's important to be familiar with the different attachment styles. Mary Ainsworth initially described these styles through a test called the strange situation. In this test, they had a mother and a child in an unfamiliar environment while the child played. The mother would briefly leave the room and then return. By gauging the child's reaction when the mother returned, they could see what kind of attachment style the child had. Mary Ainsworth described 2 different attachment styles: securely attached children and insecurely attached. Insecurely attached were further broken down into anxious ambivalent, avoidant, and disorganized attachment styles. Securely attached children responded by using the mother as an anchor in the room to explore. When the mother left, they either became distressed or they were okay. When the mother returned, they were happy at her return. Insecurely attached children are devised as avoidant, which were unresponsive to the caregiver or mother while she was in the room or when they returned. Anxious ambivalent children who responded anxiously while the mother was in the room as well as when she returned. They could not be calmed down. They were very upset. Disorganized children were frightened and behaved in a disorganized and very bizarre manner while the mother was in the room and while the mother came back. In the U.S., a majority of the children are securely attached and a minority of the children are insecurely attached.
Co-sleeping is something that has been widely debated in the United States for decades now. It is recommended that you do not co-sleep with your infant until they are at least 4 months of age. By this time, they will have grown, and it'll just decrease the risk of suffocating or anything hazardous happening that would result in the death of your infant. Co-sleeping does increase the risk of SIDS if done improperly. And the last thing you want is for your baby to pass away on an instance where a little bit of research could have saved their life. Co-sleeping also causes a slew of psychological issues. It can leave your baby feeling anxious. It can also make them feel abandoned, because if you've been a co-sleeper since day one and now all of a sudden you want to stop co-sleeping, your baby will feel abandoned and they will just be anxious, resulting in them not getting the proper rest that they need for in order to grow. Lastly, co-sleeping, if done properly, can result in like such a great bond between parents and the babies, just the babies having better sleep overall. But in order to avoid the psychological and the hardships that you will have to endure once your baby is used to co-sleeping and it's stopped, it is recommended that you just don't co-sleep, because you don't want anything bad to happen, and also you don't want your baby to be under any unnecessary stress resulting in mental instability.